Welcome to our Physician and Outpatient Medical Coding Preparatory course. In this video, we will review the learning process for prepping for Tier 1 medical coding for the CPC or CCSP exams. You have signed up and will be learning from Tier 1 content. Today, I'll guide you through the order you should study the materials step by step. This is self-taught learning, but if you get stuck, I'm happy to answer a question through my email address shown above. You must have the required medical coding reference books both for studying physician coding and for taking the CPC or CCSP exam. For physician coding, the three essential codebooks are ICD-10-CM, CPT Registered Trademark, and HCPCS Level 2. You can purchase these through AAPC, Amazon, or any retailer offering the best price. AAPC or AHIMA membership often provides a significant discount on codebooks. Always obtain the current year's editions. However, during the first 6 months of the new year, it is acceptable to use the prior year's editions. Before you dive into the course content, print out and take the 100-question pretest labeled 1AI. This assesses your baseline knowledge in physician coding concepts. Attempt all questions under exam conditions, which means you need to use your coding books. Do not peek at any answers. After finishing, record your score with the answer key. When you finish with the course materials, you will take this same test to measure your progress, which is why it is labeled pre- and post-test. Step 2 is the syllabus review. You've taken the pre-test, so you should have some idea of your strengths and weaknesses. So, create a strategic study plan. Plan with a timeline with actual dates you wish to complete each module after you have an understanding of the content. Each module is lectures, prep study questions, and case coding. Keep notes on your progress and the key deadlines or milestones you have made for yourself. This is your personal roadmap. Tier 1, Module 1 is medical terminology. If you already have a background in medical terms, anatomy, physiology, or pathophysiology, you may want to skip this prep. Next, Module 2 is ICD-10-CM for diagnoses coding. Go chapter by chapter and pay close attention to the keys for coding, which have flags next to them. Then proceed to Module 3, Current Procedural Terminology, CPT. Learn how the CPT manual is arranged, its symbols and guidelines per section to code physician or professional medical services and procedures. Module 4 is HCPCS Level 2 coding, which is coding for durable medical equipment, orthotics, prosthetics, and supplies, also known as DMEPOS. Open the HCPCS ebook. Understand how HCPCS complements CPT codes. Finally, review Module 5, which is medical reimbursement, which is the business and compliance that is tested on in both the CPC and CCSP exams. Each module is important to learn in chronological order, chapter by chapter. Read the lectures, complete the practice preps, and do the medical case coding. Each practice prep has an answer key at the end of the chapter. For Step 5, you will take the pre-post-test again so that you can measure your progress by comparing your post-test to your pre-test. The final Step 6 is the mock exam, which is 150 questions similar to the actual tests for CPC and CCSP. Both AAPC and AHIMA give you 4 hours to complete 100 questions, which is approximately 2.4 minutes per question. However, the CPC is all multiple choice, and the AHIMA 100 is both multiple choice and case coding. For this mock exam, we have 150 questions with the last part of the exam case coding for additional practice. Artificial intelligence, AI, can enhance learning, and I recommend you use it. Healthcare is rapidly embracing artificial intelligence to improve efficiency, support decision-making, and enhance patient care. Not all AI models are created equal, and it is important to learn best practices in how to use AI accurately. The right model can also be an extension of you and enhance productivity on the job. It is important to having AI use on your future resume, just like Microsoft Office. Subscribing to OpenAI ChatGPT is $20 a month. This is the best investment you can make while studying because it gives you Scholar GPT, which has been trained on over 350 million evidence-based reliable sources. It also has improved reasoning capacity compared to other models to help supplement your learning. Note that in your learning material that I have provided 3 learning resources in an AI folder. Additionally, there are several AI videos that are important to view on my YouTube channel. When studying, use only primary sources, evidence-based research, and subject matter experts, such as your coding reference books and official CDC, CMS, AMA, AAPC, and AHIMA guidelines and publications. Avoid commercial websites. When using AI, prompt it to also only use reliable sources and no .coms. Please read the disclosures shown above, which are also listed on the website. Best wishes for a productive learning experience, and reach out with any questions. Thank you.